In today's episode, we're talking about the insanity of insurance when it comes to couples therapy. Believe us, this is going to be a conversation that blows your minds. We've done this intro a few different times just because it's difficult to wrap our heads around this concept, even though we've both been in the industry. You've done clinical work for over 20 years.
Yeah, so for me, like, it was normal. And then actually like writing this topic out and, reaching out to other clinicians to make sure, is this still how it's going? Now being away from it, I'm just like, wow, this is kind of crazy.
Yeah. This is to answer the question that you guys are often asking, which is, does insurance cover 12-week relationships programs, our 12-week programs? Short answer.
No,
it does not. But we would typically think, or at least it's common, I think, to think that if insurance doesn't cover something, it's because it hasn't been proven to be effective. That's not the case at all.
That's not true. And once again, insurance is based off of, they do evidence-based practices, but when it comes to couples therapy specifically and to quantify it, this is what we're going to kind of dive into today.
Yeah. Why don't we do this? Let's do a quick little intro. Welcome to 12-Week Relationships. This is your place for better relationships in weeks, not years. My name is Pye.
I'm Dr. Glen.
Because I always forget, I'm just going to say this. We have an awesome new guide. It's called The Secret to Healthy Relationships. You guys can find it in the link to the YouTube video, or if you go to our Instagram, it'll have a link right in our bio that'll take you to it. It's awesome. We go through our core value framework. It's, again, because a lot of you have asked us, what are my core values? And so instead of saying it's complicated, we made you a free guide that you can download and get a glimpse into your values and our process.
It's really cool.
We have that and the newsletter, which you'll get as well with the guide. So be sure to check that out. Now, let's jump straight into today's topic. First, it's important to understand that the way that insurance works, so it's based around evidence-based practice, but the reason that you get coverage for some things and not others is because the level of proof that has to be demonstrated is sometimes just not possible, because you're talking about things that are subjective in nature, right?
Yeah, so when it comes to couples therapy, you're dealing with relationship issues, right? So for example, there's something known as a DSM, the Diagnostic and Statistical Manual. And basically for insurance to cover you, you have to have a diagnosis that is deemed worthy, that your symptoms are bad enough that insurance is willing to cover it. That's number one,
correct,
right? And then, there's something known as like, regular behavioral factors, right? Like job loss or job stress or relationship issues. Those are things that are not considered a mental health disorder, but just like life issues that you're struggling with. Mm-hmm. So if you take couples therapy from an insurance standpoint and you just put relationship issues with no like known mental health diagnosis, that's not something that they're going to want to cover unless you have like a higher premium that's going to cover couples insurance. But usually that's very, very rare.
Yeah. And I want to take a step back for just a second before we dive into the couples aspect of insurance, just looking at insurance in general. If you're talking about, people that live in, again, insurance operates differently throughout the world, right? But in the United States, it's a business. Insurance is a business. So there's not really any type of coverage that they want to give you. They want to make money, and they'll cover what they have to cover, right? To meet that end goal. So when they're talking about evidence-based practices, like things have to basically be proven through a series that is not only incredibly expensive, but shows that objectively something works. One of the reasons why so many treatments are not covered, even though they're effective, is that it is incredibly expensive and difficult to prove that process to the level that an insurance company would want. Great examples of this: stem cell therapies, blood or platelet-rich plasma, like PRP therapies.
Yeah, for your knees.
I've gotten those on my knees. They're not covered by insurance, but they're incredibly effective. Now, why aren't they covered? Because, doing the study itself is very expensive. Who is going to be willing to take that on when, the clinics that are doing PRP, they're not making billions of dollars doing it. They're making money doing it, but they can't fund a study. And on top of that, when somebody walks away, what are you measuring? Like, do I just check off on a box of 0 to 10? Like, has my knee improved since PRP? How is that objective in any way? And so an insurance company can very, simply just say, deny coverage for something because, it's not proven to be effective. But it's not true. It is very effective. It's just that they haven't met your criteria for what effective means.
But also, you mentioned it's a business, so they want to be as cost effective as possible.
Correct.
So their array of treatment options and evidence-based practices is what they deem is practical to them.
Exactly.
And they're trying to figure out if you don't fit this containment of space of what the insurance wants, then you're someone that they're not going to cover.
Exactly. A huge portion of these studies that prove that something is effective, that something works, is either done by the drug companies that are making billions of dollars off selling the drugs, or off the insurance companies that are saving billions of dollars from proving something effective. So basically, something like PRP or platelet, I'm not even going to say it again. Platelet enriched something like PRP or stem cell therapy, right? It will probably become covered with insurance once an insurance company proves that it reduces their overall long-term costs.
And it becomes profitable.
Yes, when it's proven that this long-term is more profitable than allowing people just to do surgeries and do all these expensive things, then we'll cover it. But they're going to be the ones that probably do the research for it and approve it.
Yeah, I mean, like just like with marijuana or like microdosing with hallucinogens, like it's been proven effective for like trauma and PTSD, but it's not on their formulary and it's not something that they've incorporated, but they probably will. And as they're doing the research and the studies, that's going to be something that's going to be part of insurance eventually.
Yes. So now let's go to psychotherapy, and then we're going to go to relationship therapy. See, in the space of psychotherapy, we've talked about this before. What is the difference between psychotherapy and coaching? And what we've brought up is that what you have here is a spectrum of mental health. On the low end of that spectrum, we have unhealthy, unable to function. What would be the diagnoses on that side?
Like major depression, schizophrenia, bipolar disorder.
Yes.
It's considered a chronic and severe mental illness to the point that your daily functioning is being compromised, and the goal is to get you back to a normal level of functioning.
Correct. And so from an individual standpoint, psychotherapy can be very effective because it's taking you from an unhealthy standpoint and giving you whatever treatment, whether it's, talking, whether it's drug treatment, whatever it might be, but getting you treatment to get you to a functionally healthy state.
And maintaining in that space.
Which
is hugely important.
Yes. Because the goal of once you're there is to not push. It's to stay here. It's, look, you're doing okay now. Don't do anything to jeopardize your mental health, right? We can't push too far. We don't want to go this way. It's to keep you there. Now, psychotherapy is awesome from getting you to unhealthy to that space, then not so awesome when it tries to keep you there.
Yeah, because the ultimate goal is maintenance, right?
Correct.
Symptom management, maintenance, and whether you're seeing a psychiatrist or a therapist, the evidence-based practices is if you extend yourself emotionally too far out of this box, that may damage your self-esteem. So maybe you don't want to do that. What can we do within your emotional box where you don't go too high or too low? Or if you get too depressed, that's not good either. Let's maintain in this space, this middle space, and try to build a life within that space so you're not overextending yourself, not underextending yourself, and you just kind of maintain.
Correct. But at least we can say from an individual standpoint, psychotherapy taking you from unhealthy to functional
and normal
is proven to work.
It's hugely effective.
Yes.
Yeah.
It is very effective. So much so that we would say, like, when we talk about coaching, right? We say that, look, if you're not functionally healthy, our program is not for you, because we want you to go back to psychotherapy to get yourself to a functional space. But once you're in that space, you're done with psychotherapy, because the role of psychotherapy, at least if you are, if you don't have something that is chronically, like you're shifting back to those places, if you're in a functionally healthy place, you now need to step beyond what psychotherapy can provide, beyond these major diagnoses. And now you're looking for quality of life improvements. You're looking to move up the spectrum and improve.
Yes.
This is where insurance doesn't offer any coverage, or at least if it does, it's very expensive on that side, right?
Yeah, because you're no longer viable for treatment. You're beyond normal. This is not something that they want to cover.
Correct. And it goes back to, again, how do we objectively prove that you are happier, that you are, you're already functional. How do we objectively prove that you're now living a better quality of life? So again, trying to meet the standard, the metrics for comparison and measurement is virtually impossible, or so cost prohibitive that it just becomes impossible.
Yeah. And then, using like a more medical insurance example, like cleaning is covered. Like if you go to the dentist, cleaning is a covered insurance practice, right? Mm-hmm. They floss, they do all those things for you, right? However, implants or things like, for example, like getting like a mouthpiece or a mouth guard. That's coverage that you're going to have to pay more for because it's considered a luxury thing.
Yeah.
That's going to improve your quality of your teeth, but it's not something that's for
necessary. Yeah. Okay. Now, this is the part that is going to blow your minds, because now we go over to the relationship therapy side. And you will notice that sometimes insurance will cover relationship therapy. Sometimes they'll charge more for it. Sometimes they cover it. Sometimes they don't, right? But I want to talk about the cases where they're actually covering it, because you guys don't understand what they're actually covering. And this part, and I'm sorry, there is no other way to say this part is absolutely fucking insane. There is no
How do you
other
really
way.
feel? Yeah.
That is how, I have stated how I really feel. Because what's going to happen as a couple is you go in to see your therapist. And what they're going to do is, if it's covered by insurance, they're going to give you a major diagnosis.
Yeah, because if they don't, it's going to be considered a luxury thing. Like, this is a relationship issue. And the truth of the matter is, then they're going to have to pay out of pocket. It's going to be really expensive. It's basically like a private practice fee anyway, right? So a lot of times the clinician, what they'll do is, knowing that, they want to make it cost effective for you, they'll give you a mental health diagnosis. Some of the most common diagnoses, like major depression, generalized anxiety disorder, maybe like a social phobia diagnosis. Even though you may not have it, if you came in for couples therapy through your insurance plan, knowing that you don't want to pay the copay, maybe $10, but if I don't do this for you, you may have to pay $100, or whatever the case may be, right? Because insurance is like, this is luxury. Then I give you the diagnosis. Pye, you're depressed, you have major depression, your partner has generalized anxiety disorder, and then I'm going to justify it through the insurance plan so that you guys can get couples therapy covered.
Yes. And this is the part that is just whacked out beyond belief, because to put this another, like, I feel like this has to get hammered home repeatedly. What this means, and we, by the way, we took extra time before filming this episode, because you said, well, this is how it worked when I was doing clinical work in this setting. Let me verify that it still works this way. So you did.
Yeah. So I reached out to some clinicians that are in private practice settings, and they're like, yeah, it's pretty much still the same.
So in context, I have a problem with my spouse, let's say, for example, and I go, we should really seek some therapy. We are we're just not on the same page right now, and we seem to be arguing a lot, and I want us to be closer and more intimate, right? Mm-hmm. We go see our therapist. Your therapist does not tell you this. At least I've never met a therapist that does.
Well, I would tell them.
You will tell them.
So this is the thing, though. I would be really transparent, because I'd be like, because you got to do a full assessment form. So when you two come in, unless insurance is like, yeah, they paid their copay and you guys could just do it straight, I'd be like, look, man, I have to do a full assessment on both of you. So I fill out 2 assessment forms, and I'm like, yeah, to make sure that you guys just cover your copay or you don't pay anything, I have to give you a mental health diagnosis. I would tell them.
Okay. I would
tell them.
I have never met a therapist who has actually explained why I'm filling out those forms, ever. And I've seen quite a few. But what's going to happen, whether they tell you or not, what's going to happen is you're going to fill out the assessments. You're going to sit down, and what they're going to do is they're going to then determine, me and my wife, which major diagnosis do we have? They're going to say, well, Pye looks like he's depressed, so we're going to give him major depression. And Yen looks like she has social anxiety issues, or maybe she's even bipolar, or whatever it might be. And they're going to give her a diagnosis. And then each week that we come back, we're going to be treated from those standpoints of like, well, now they have to document the improvements, right? Well, what are we doing to help with these diagnoses? We went in for marital help, but that therapist now has to document, well, in terms of Pye's major depression, these are the things that he's going to specifically do. And I'm even saying that maybe he should see a psychiatrist so he can get something here. And for Yen, these are the things that she's going to do. Our treatment is going to be based around these diagnoses of what must be causing our relationship problems.
Correct. So from the insurance standpoint, for the billing, to justify everything, all the notes and all the documentation, even though like couples therapy is happening, is based on your depression and based off of her anxiety.
So we might have a difference in values. Our values just are not aligned. We might just not be compatible. We might be but you're going to treat me for depression.
On the insurance side, on the paper side.
Correct.
And oftentimes, like, clinicians will be like, okay, they write the notes, but in truth, they're just providing couples therapy, right? But then on the note side, it becomes, well, this is where we're providing a depression treatment plan for you and an anxiety treatment plan for your partner.
Yeah, but I've also had it the other way. I mean, there are good therapists who will just game the system, which is already messed up in and of itself, that they have to game the system to get insurance coverage for this. So you have that group of people who are good therapists who are basically just writing what they need to write so that this couple's insurance covers them. And then they give them the appropriate treatment. They give them like actual couples therapy, which in and of itself, again, has its own problems. But at least they're doing that, right? Then there's the other set. And I've met with plenty of those who will say things like, this sounds like something that you need to deal with. It sounds like you have depression. It sounds like you have anxiety. Are you taking drugs for that? It sounds like this issue stems with you. I've met plenty who will actually treat the couples therapy from an individualistic standpoint of like, you must be unhealthy.
So they're following that insurance plan to a T, basically.
They're basically following the traditional model of psychotherapy, which is in order to create a healthy relationship, you must be unhealthy and she must be unhealthy. I must bring you to a healthy space and then you coexist.
Yeah, and which goes against what couples therapy should be. Because you guys are coming in as a couple talking about couples issues.
Absolutely.
Yeah.
Okay, this is going to get even more crazy because we had you go and actually collect some of these notes and what these notes look like. And I'd like you to read them off.
Okay, so this was actually a note, progress written on couples therapy. We're not disclosing anything, but this is a note for one of the partners.
Yeah, no names, no nothing.
No names, nothing. So so this person had to be given a diagnosis of major depression. So the note says, client will reduce.
By the way, do you know that this is the SMART goal framework? So he's going to present this to you in the SMART framework. This is how you create, like, businesses across the board use the SMART framework.
Yeah, and they use that framework for progress notes too, because it's measurable, it's specific.
Okay.
And then you can chart progress. And then especially when you're dealing with the insurance companies, we can go into this later, it's your way of explaining improvement.
So this is one therapist's notes for a specific couple based on the SMART framework.
Yes. And then based off of the individual diagnosis of major depression.
Okay.
All right. So this is the note. Client will reduce depressive symptoms by attending individual and couples therapy sessions weekly for the next 3 months. Client will reduce his depressive symptoms on a scale of 1 to 10 from an 8 down to a 5 in the next 3 months.
This is exactly what I'm saying. Like the approach. Now, whether or not this therapist is actually doing this with them, like, is this the therapy that he's providing to them is focusing on depression, or whether he's actually providing therapy? We don't know.
We don't know.
But so many follow it from this standpoint too. This is insanity.
Yeah, I mean, even if your intentions are good, if you're writing these things down, it's going to confuse the intent. It's going to enmesh with what it was trying to be accomplished, especially from a couples therapy standpoint.
Yeah, because whatever you're trying to do, you're going to think back to what you need to prove. So it doesn't matter what you want to do. It matters what you have to write down. And it's going to taint the entire process.
No, it's true. It's true. And in the least, it makes it really, really confusing.
Or waste time. Like, how often are they writing bullshit notes that, like, instead of listening to what I'm saying? Like,
no, you're right. It diverts the lens. Like, oh, you guys are coming, but I got to get the billing down. I got to do this. Yeah. You're right. It diminishes the sessions.
Okay. Sure. Next. So we've got the S and the M.
And then we have the A, attainable. Client will utilize at least 3 healthy coping skills weekly that include cognitive reframing, diaphragmatic breathing, and stress inoculation when confronted with negative thinking.
Could be helpful in a context of relationship. Okay, relevant.
Client will improve his confidence individually and his intimate relationships by using more positive self-talk. And then the last one is timely. Client will return to both individual and couple sessions for next week.
This is why I've been calling bullshit on this for so freaking long. And now you're calling bullshit on it as of last year. Well, actually, you started calling bullshit on it a while back. Because you get into a space of like, look, just going back to your story, you're in a space where you're in an unhealthy environment, unhealthy work environment. It's affecting every aspect of your life. It is toxic. Any person looking at what was going on, the death threats, the notes, destruction of your property, things left at your home, all this crap that's happening that your coworkers that are doing because, well, one specifically, because they're threatened that you might get a promotion. That's insanity. And yet, in that situation, your psychotherapist says, well, don't rock the boat, Glen. I know you're a psychotherapist, Glen, and you have 20 years experience doing that. And I'm a psychotherapist, Glen. Don't rock the boat. What you got to do is just maintain.
You got to go back.
Yeah, you got to go back. That's the place that's the thing that makes you happy. That's the happy place, You used to be good at coping with that, and we just need to go back to that.
Yeah. Versus like, no, that's when I was the sickest and I'm getting healthier because I can't deal with that anymore.
This is what that framework teaches.
It teaches. And that's why, like, from a foundational standpoint, when you talk about all of the complaints, especially the people that come to us and they're like, it's week to week, it's managing, it's who's the winner this week. And it just keeps coming back. It's all falling in line in terms of this medical model and symptom management of treatment.
Yet the only positive benefit that's occurring under this model is just that you're paying someone to listen. There's some validation being offered in the sense of like, not necessarily validation from the person, but there's someone there to like listen. It's venting. So during the session, there's the feeling of like, I've got this off my chest. There's a venting feeling of, I feel better. But that only lasts as long as the session lasts, and then that's done.
Well, the goal is maintenance, right? And ultimately, if we take it a step further, it's mediocrity. It's maintaining mediocrity. That is the goal.
Okay. I got to ask, like, if you guys think this is as insane as I do, and I know that you do now, if you guys think this is absolutely batshit crazy, please comment. Let us know that we're not the only ones that are like, how is this possible? So when people ask, is your process covered by insurance? I understand maybe it's a price thing. It's I can't afford this, but you have to know when insurance says that they do cover something, this is what you're getting.
Correct. It's from this lens of a medical model of treatment.
And if you're looking for improvements, making, our relationship better, becoming closer, being more in tune and aligned, and being able to just be more fulfilled, that is nothing to do with what this is.
Correct.
Okay, I want to make that painfully obvious. You wrote another one. Clinicians will often downplay the therapy progress. Oh yeah, this is beautiful.
Yeah, so usually they do like a check-in. So usually like sometimes like it'll be like the assistant or the administrative staff, they'll call in and they'll just read the notes.
Yeah.
But sometimes like they'll want to speak to the clinician directly, and they'll be like, okay, well, what's going on with the client? And this is where it gets dicey, because I remember oftentimes, if the client would they wanted to continue treatment, I would have to say they're not doing so well. They need extra time. So I would, well, there's improvement. They're not, but they would ask, like, are they suicidal? They're not suicidal, but they're moving in that space. But there has to be some extra treatments to maintain, because they have some stressors in their life, and there's the relationship issues. And they're like, okay, well, we'll give it 10 to 12 more sessions, right? So you would have to negotiate with the insurance company based off of the diet. But then this is the thing, they would ask based off of the diagnostic criteria, right? And then this is the one thing that I would do, is I would let the clients know this is what I'm going to do. Because if they're not comfortable with it, I don't want to do it, right? Mm-hmm. But I would let them know, like, to maintain coverage, this is what I would have to do. And if they're like, yeah, then usually they're like, yeah, I don't care. It's fine. I don't care what's in it. It's confidential anyway. Fine. I don't want to pay for the treatments. I just want more treatments. And that would be the end goal.
This is, this stuff blows my mind, dude, because we're basically forcing doctors and clinicians to play this game. And the game is the insurance company doesn't want to pay for anything. They're a business. They want to save their money. So they're calling to see, hey, do we still need to, cover this thing that is making us less profitable? And that's the only reason they're checking. It's not as if they're checking in to be like, oh, we want to make sure that this person's health is going towards the right direction. No, they just want to stop paying for it. So they're calling to check if they can stop paying for it. And people have an issue with it because they're thinking to themselves, like, for my family, I already spend $1,000 a month for coverage, for insurance coverage, right? For health. I don't want to spend more.
Right.
I mean, like, that should be covered. But the sad truth of it is, if I were to minus we're all insured for potentially catastrophic events, right? If you were to minus out those catastrophic events or the possibility of like, you know, a child breaking their arm or whatever might happen, a sports related injury, every one of us, and my own family for sure, we would be better off if we took that $12,000 and spent it as we needed it. Just as we needed it on whatever services were actually necessary, minus any major surgery, any major catastrophe.
Yeah, because you could focus in on what really matters to you, the quality and the improvement that you're seeking.
Yeah, like a program like ours, $1,500. If you want one-on-one, you know, $2,500, $3,000, whatever it is for 12 weeks worth of sessions, right? I could spend that and be done with my insurance for the entire year. I'm like, no, I got my coverage. I got what I needed for my relationship. I'm good.
Yeah, and then the argument, like using a more like medically specific example, like Invisalign. Invisalign, you can argue that it's not a necessity.
Yeah.
But it's going to improve the quality of the person's life, right? They don't have braces. They could take it off and on. It's clear.
Yeah.
It's going to improve their quality, right? Why wouldn't you want to cover that?
Well, and you want like even more asinine. How many doctors, researchers, it is common knowledge at this point that the body must be treated holistically. Your mental health, your physical health, it's one and the same thing. It all has to be treated. It's not independent from one another, right?
Correct.
But an insurance company is saying that, well, if you want me to pay for you to fulfill your life, to have a happier relationship, to have a happier this, that really doesn't affect your mental health or your physical health. It's literally proven, assholes, that it does. Like, we literally have studies that say your relationships an unhealthy marriage can decrease your life expectancy by 5 to 10 years. It also reduces your immune system response. It means that you're more likely to get sick. This is literally evidence-based knowledge. And an insurance company will say, yeah, but, you know, helping you in your relationship doesn't really have anything to do with your health.
With your quality. Like, this is a luxury product.
This is a luxury.
Either pay for it, or you better have a correlating diagnosis that justifies that you're getting this secondarily.
But how insane is that? How insane is it that the same industry saying that we must be treated holistically,
I agree,
is saying that, well, this treatment doesn't count towards your health?
Because it comes down to dollars and cents. And if you watch insurance commercials, they're all about being holistic. You take initiative with your health, but get coverage. And then what happens when you actually get the coverage? You get this.
Yeah.
It goes back to this medical model of treatment.
Okay. I'm hoping this gives everybody a clearer picture into what we mean when we say the medical model of treatment and kind of our, well, they very clearly know my thoughts on this, and you've maintained a more objective standpoint, which I appreciate.
Thanks, man.
But seriously, they're all a bunch of assholes.
No, it's true. It's all for profit. It can be really dickish. It's not saying that there's not good people in between, but the whole premise of it is ass backwards, and it doesn't make sense.
Oh, well, you had this for your last point on this was the longer the couples treatment, the worse your documented mental health symptoms are.
It is true. Like, if you have to continue to extend coverage, basically just know that your clinician is like, yeah, this person's pretty fucked up right now. They need more long-term care, man. They're amping it up to make sure that you're getting the coverage so that you can continue to come in. Which
is also going to screw you up when it comes to getting future insurance, right? Because so here's the last and perhaps like, the cherry on top of this fucked up cake, because that's what it is that let's say you've been going to your couples therapy for 2 years. And your clinician has this long documented list of just all this bullshit stuff that you must have, your anxiety issues and your depression issues. And then you switch jobs and they switch insurance carriers and you go back for coverage. And the new insurance carrier says, we'll cover them, but it's going to be 30% more expensive because look at this list of pre-existing conditions that this person has.
Who knows? I mean, hopefully it remains confidential. Hopefully.
Your medical history is a part of the, like, they know like which medications you're taking. They know all that stuff. When you go for new insurance, they ask every single one of these questions. What insurance, what have you had? Like, what are some of the diagnoses you've had? What are the drugs that you're on?
Yeah.
I've had companies deny coverage. This was way back before, like when I was in college. I had a company deny coverage because I was taking an acne medication.
Seriously?
And it was like 12 months prior
That's crazy.
that I stopped taking it. They're like, yeah, you've had one medication. I'm like, are you serious? Like, so I can't get, yeah, you're considered like, we can't cover you.
That's crazy.
What is everybody else doing that actually has medical conditions and they can't get, coverage?
Yeah. No, that's a really good point. So if they review it, I'm sure it's going to affect your premium.
Yeah. I don't know what it can, I don't know where the limitations, like maybe HIPAA laws have now prevented them. It's been 10, 15 years since I've gone through that process of like applying for new health insurance. So I don't know what it is now.
I mean, I know this, like insurance, like after a long period of time, after they'll be like they'll call, like it's like right on cue, and they're like, what's going on with this client? And they're like, well, if they're this sick at this point, they need more intensive care. So we're going to cut them off in like 4 more sessions.
Yeah.
And then I got to wrap it up, and then they got to go somewhere else.
That's so wild, dude.
Yeah.
So bottom line is that I have found health insurance to be effective when it comes to catastrophic needs, when it comes to like, I'm sick, I need something right now. That kind of stuff is helpful. Albeit I've most certainly paid far more in insurance than I've actually used in the services that I've been covered under.
Me too.
And then when it comes to quality of life, when it comes to things that actually do affect your mental health, that do affect your physical health, most everything that I've done has been outside of insurance.
Yeah.
My knee injections, my own personal work and therapy, most everything that has actually made a difference in my life, coaching, all those things have been outside of therapy, even though they've had a direct impact on both my physical and my mental health.
Yeah, because you were looking for quality of life answers versus maintenance.
Yeah. But in paying that money, I did bring the insurance company's cost down. So
there you go.
I mean, I helped them out.
You helped them out. You hooked them up. Yeah.
And that is our 30-minute long answer to why no, our program is not covered by insurance.
Yes.
But it most certainly will improve your life. It will improve your physical and your mental health. And it will lower the cost of your insurance and of your health coverage.
And the goal is to improve your quality of life.
Yes. So anyways, I hope this was a interesting look behind the scenes into this industry and all the things that like, I don't know how you would begin to make change in such a complicated system and process, but
the whole thing needs to be revamped.
It needs to go.
Yeah.
And it needs to be redone.
Yes.
This is insane.
Yeah.
All right. That's it for y'all this episode. I was going to say that's it for y'all, but it's not for y'all. That's it for us in this episode.
Yes. We're done.
Okay.
We're done.
In the meantime, though,
we're cutting you off like the insurance company. That's it.
You guys can hop on to 12weekrelationships.com and grab the secret to healthy relationships. Actually, if you're on YouTube, we'll just link them up so you guys can jump in and grab it right from there. If you're on anywhere else, if you're on Spotify or wherever you're listening to this, the easiest place is probably just to go to our Instagram page at 12weekrelationships, which probably most of you guys are following anyway. And in our bio, you'll find a link which will take you right to that guide as well. This is a handwritten guide, helps to answer the questions that you guys have been asking, like what are my core values and what does your process look like and all of that. So it's a free and awesome guide and workbook. Please download it. Tell us what you guys think about it. You guys can reply to us in any of our newsletter emails. Let us know. We'll see you guys in the next episode.
Thank you.
Peace.